Okay, we're going to go ahead and go through doing a chart, doing an intake for a patient that's come in for an ultrasound. So the first thing that patient will get when they walk in the door is an ultrasound intake form. And so they will be in the waiting room and they will fill that out. And basically the information on there is going to be their name, their date of birth. One of the things that we want to do when they come in the door is make a copy of their ID. They'll have on here their address, and that's important for us later. Their home phone, cell phone, email. We also ask if it's okay for us to contact them through different avenues. And we ask if it's okay for us to leave a message on there. We ask their ethnicity, their occupation, and then just some basic information about how did they hear about us, what help are they receiving from outside. And that's important because we like to share a lot of community resources with them, and we'd like to get an idea of their lifestyle and the culture at their home. We ask their marital status, who they're living with. That gives us an indication of their lifestyle. Also, we like to know who they came with for each appointment. And also we have on there their children. And on the next page, one of the important questions for us is their religion. And we have several choices that they can make. And then we ask, what is their relationship with God? Is it close? Do they desire to be better? Is it okay? Or do they not have one? And that's really important as we go toward the, even at the beginning, but toward the end of our time with them as we seek to share the gospel with them, kind of determining where they are spiritually so we can go from there. After that, the rest of the intake form is basically signing the consent that they allow us to do their ultrasound or their pregnancy test. And the last page is the Notice of Privacy Practices Acknowledgement. And we give them a laminated sheet with all the HIPAA information on it, and we ask them to read that and then sign this last page saying that they agree with that. Once we have that finished, we're able to take them back to the ultrasound room. And from there, we have them set up for a pregnancy test. Every ultrasound has to have a pregnancy test done by either a doctor's office, they have to bring that acknowledgement, or we have to do a proof of pregnancy. We have to do a pregnancy test for them to have a diagnosis to be able to do the ultrasound. Many of them have had a pregnancy test, a self-pregnancy test at LifePlan already, but that does not count for the medical side. It has to be a medical diagnosis from a medical personnel. So once we do the pregnancy test, we'll give them a proof of pregnancy that they can take to their doctor's office. Another sheet in the chart is the authorization to release information, and through that we are able to send the results of their ultrasound to their doctor's office. So we have 6 different doctor's offices in the area that they can choose from, or we also have a spot where they can put another, and they can have the address for that. We need to make sure that they sign that so we can send their information to their doctor. The next thing we'll do is the medical history and assessment form. And at the same time, we'll take the limited ultrasound report, which is really for the sonographer. But the first few lines of information are the same on these 2 forms. And the nurse will fill out the information for the sonographer on her form, information that she would not have available to her. So basically on the ultrasound report form, we'll get their name, their date of birth, their client ID. That ID number is important for the sonographer to be able to put that into our ultrasound machine so we can keep track of each client individually. We'll also give the information for the last menstrual period and the due date and the estimated gestational age. And then what are the indications for the ultrasound. And we also need to sign whether the father was present and if we were present during, what nurse was present during the ultrasound. So that's the basic information that we need on that sheet. And then we go over to the medical sheet. And again, we have the patient number, the patient name, and date of birth. Also a check to make sure that we have a copy of their ID in our records. And there's several reasons for that. Mainly that is a medical requirement in doctor's offices that we need to know that we are actually treating the patient who they say they are. That's another screening question for sex trafficking, as many times in those situations, a patient will not have their own identification, and that will give us a heads up to ask more questions. One of the first things we ask is, are they already in prenatal care? That's really important. I know Dr. Ashton really likes them to get in start prenatal care at 8 weeks. It's been a little bit different with COVID. I think they're pushing it out a little bit, but they are having a phone intake at doctor's offices. So we want to really encourage them to get in prenatal care. We sometimes have a problem with moms not thinking that's very important. So they will come to LifePlan thinking that, oh, I'm just going to check and make sure my baby's okay. I'll get an ultrasound and then I'll know everything's fine. And that way they kind of, they don't get into prenatal care as quickly as they should. So that's something that we should encourage them. The second thing we want to ask them is if they're taking prenatal vitamins. And we do offer free prenatal vitamins. And the reason we want them to get on those as soon as possible is to help prevent spina bifida. They need to have folic acid. And so if you can either encourage them, a lot of times they're having nausea, so it helps to take maybe gummy bears if we encourage them to do that. And again, we have free prenatal vitamins that we can share with them. The next question is, have you had a previous ultrasound for this pregnancy? And if they have had one where they have already received proof of the gestational age of the baby, if they know how far along they are and they have a due date from a previous ultrasound, we cannot do a repeat. We are a limited medical facility, and again, we're trying to protect from people coming in just to avoid prenatal care and to just get an ultrasound and get assurance that way. The other thing is we don't want to compete with their doctor. We want them to, once we do an ultrasound, we turn them over to their own doctor, and we want to encourage that. The next question is, have you had any vaginal bleeding? If they are having any bleeding, we will not do an ultrasound. That's kind of a call that we have to make if there's just slight spotting and it's not full out bleeding. Sometimes we can just gauge by questioning them a little further how bad it is. But again, we're a limited medical facility, and we want to point them to their doctor if they're having any problems. Again, if they've had a previous ultrasound, some moms come in and they've had an ultrasound at the emergency room and just a quick check to see if the heart's beating, and we can go ahead and do an ultrasound if they've had that. The next thing we'll do is there's a line for confirming a positive pregnancy test, whether it's performed by us or by a doctor's office. We need to record that there. And then from there, we'll ask them when their last menstrual period is, and then we can figure out by our calculations when the gestational age is and when their due date is. And the timing of doing ultrasounds, we shoot for between 8 and 10 weeks because that's the best time to measure a baby to get a due date. After 8 weeks, after 10 weeks, the babies all start growing at different rates. So if we can get them in that window of 8 to 10 weeks, we get the best measurements. Anything less than 8 weeks, it's a little difficult to measure. Sometimes we'll get moms to come in their last menstrual period, they're confused about it. The baby ends up being smaller. And so many times with that, we will have them come in 3 weeks later and do a repeat ultrasound. Sometimes they're unsure of their last menstrual period, and so at that point we have to determine whether they had a miscarriage or not. So that's part of why we wait a little bit longer to 8 weeks, just to make sure, and to make sure we don't have to put them on that emotional roller coaster of worrying that they had a miscarriage if it's just that their menstrual period dates were off. The next question is how many pregnancies, how many living children, how many abortions, whether it's a miscarriage or an induced, if they've had an ectopic pregnancy. That's all recorded in that next line. Then we ask if they have any pre-existing medical conditions related to the pregnancy. Sometimes moms will have a history of high blood pressure, or they've had preeclampsia and they're afraid about going through that again. We had one mom who had heart problems and came in considering an abortion because she was afraid that she wouldn't be able to have a healthy pregnancy. And so we were able to connect her with a specialist in that area, and she was able to carry that baby to full term. So we want to discern if there's any fears that the mom has about the pregnancy that might cause her to want to end that pregnancy. The next question we have is any allergies, and right after that, any allergy to latex. And we want to make sure that we know that, because if they have to have a vaginal ultrasound, we use a probe cover that's made of latex. And so we also have another kind that isn't latex. So we want to make sure and protect them from any allergy. The next couple questions relate to lifestyle. One is, do you smoke? And we always encourage moms, if they do, that this is a good time to quit. And if they need help with that, that's part of our Life Matters program, so we can really point them to getting help through that. The other question is, have you used drugs or alcohol since your last menstrual period? And one common thing I find is that many moms today will say they're using marijuana because they have nausea or anxiety. And I think because it's legal now, they tend to think it's a medicine, it's not going to be harmful. But there is indication that can cause low birth weight, babies of low birth weight, and also possible a miscarriage. So that's something we want to teach them on. I know another thing is that in Michigan they will test babies test the baby to see if the mom had used marijuana, and that information can be turned over to CPS. So it's a good thing to warn moms about and help them with that. Again, that's something we can point them to Life Matters. The next question I have on here is, do they have a history of tubal ligation or ectopic pregnancy? And one of the things with this, and even back up in the question about have they had a previous miscarriage, one of the things that this can lead us to be able to do is teach about miscarriages. In our chart, we have miscarriage precautions, and that's 2 pages that we give to every mom. And we just share that if they have bleeding more than a normal period, or clotting, or cramping more than a normal period, that they should contact their doctor. And if they're not in prenatal care yet, they should go to the emergency room. And so we can kind of go through that teaching at that time, and also share with them that if they do have a miscarriage, that LifePlan does counseling and encouragement for moms who have lost a baby that way. So that's a good time to bring up that teaching. And also with that kind of leads me to go into, if I have time, and this is kind of, you have to gauge. One thing I've had recently is moms being really uncomfortable because they have to come in with full bladders. And if they are so uncomfortable that asking them all these questions and having these conversations with them is kind of painful, I will kind of determine quickly what I can go through, what I need to ask on the medical history and assessment right then. And then if they're so uncomfortable, I'll have the sonographer come in and do the ultrasound so that we can come back afterward and do some of this teaching. And normally I've done the teaching during the assessment, but I would say most recently I've had the last 3 moms have been so uncomfortable that I've kind of forego the assessment and get their ultrasound done and come back and do the teaching. It's kind of just have to gauge, have wisdom and gauge where they are with that. So I'm going to go right now and share. We have a pregnancy packet. It's a blue folder that we give to every mom. And I've chosen a few things to share with them that I feel will be most helpful. I know they're going to get a lot of information when they go to their doctor's office. And I know that a lot of moms today would prefer digital resources. So I just give them a little bit, and a few pamphlets and a few area resources just to get them interested. And I think with LifePlan, our medical practices are an opportunity for us to share the gospel. So we got to kind of keep that balance of not focusing so much on the medical, because they're going to get that in their doctor's office. We're here to speak into their lives spiritually, and that's an aspect that they're not going to get from other area resources. So that's why I kind of keep this part simple. But we have in here, one of the first things I share with them is our Life Matters program, because that's really, with the ultrasounds, with the pregnancy tests, with the STI testing, all these medical opportunities are really to get these patients to come in for our Life Matters and develop a relationship at LifePlan so they can grow spiritually, hear the gospel, and grow in their relationship with God. So I just go through what our Life Matters program is and just share a little bit about the different areas that they can study. There's pregnancy, infant care, parenting, healthy relationships, spiritual growth, and several other opportunities there. And then I just explain in phase 1, we get a certificate. Phase 2, you earn a diaper bag with lots of neat baby stuff. And then phase 3, when they complete Life Matters, they get free baby pictures by a professional photographer and a haircut from a stylist that we have at LifePlan. And so that's just an encouraging way to get them to sign up. And, I share that what our baby boutique is and what they can earn there. And that's a real incentive for a lot of moms who don't have the material needs that they need. The other thing I have in the pregnancy packet is all the lessons for Bright course. And I think they're constantly adding more and more. So this is a really good opportunity to just show them the type of classes that we offer in our Life Matters class. The other thing I do for them in regards to Bright Course is I will often ask them if they would like me to send one of those lessons to their phone just to see, just so they can see what the videos are like. So we can do that also after their lesson. We can sign them or go ahead and send them a sample course so they know what that's all about. Another thing I have in the pregnancy packet is a pamphlet on sexual health. And one of the questions coming up here, the next one I think, is that have they been tested for STIs? And normally, I mean, anyone who goes for OB care, the first appointment that they have, they'll do a blood test and they'll do a urine test for STIs. So if this person, if I discern that they're probably not going to go right away and get prenatal care, if they've been with several people, I will suggest that they have an STI test done at the same time as their pregnancy test. If I discern that this is a mom, this is someone who's married, she's got a stable marriage, and I know she's going to be in prenatal care, I just trust that she's going to get that STI testing when she goes into her doctor. But this is a good opportunity to point them to Life Matters for sexual health teaching. And so I have that pamphlet in there. I also have a resource for different area resource centers, the different hospitals and doctors, also where they can get STI testing and immunization. Also, I have in there WIC and Ferry Street Resource Center if they're interested in for jobs. So we have a resource for the Shelter for Domestic Violence. So they have a sheet in there where they can just see local resources that might be helpful in their situation. Another helpful pamphlet I have in here is How at Risk Are You? And that's related to exposure to STIs. And it's just a really good teaching tool about STIs. So I have that in there. And sometimes sometimes I get moms from local churches coming in who have a close walk with God. And I don't emphasize that as much, obviously, but I do offer that anytime. I just say, if you know anybody who might be interested in that information, you can share that with them. The last thing I have as far as brochures is Protect Me While I Sleep. And that's basically teaching them safe sleep. And just, I also have a little sticker in here that says, protect me while I sleep. I belong in my crib on my back every time without any stuffed animals, blankets, bumper pads. And I just encourage moms to not to sleep with their babies, as this pamphlet says. We had one mom come in for an ultrasound, and a year later she was back in again, and she had lost her baby as she and her toddler were sleeping on the couch with their baby, with the baby. And so it's just that that is not safe. Also, we've had area mothers lose their babies through even falling asleep in a chair. So I just really emphasize that, as it's a reality that safe sleep is really important. The other thing I encourage them is not to take their babies out of their car in their car seat and set them in the house to sleep. That car seat is in a base, and the angle of the baby's neck is safe in a car seat in the car. But once you take that out of the car and put it on the floor in the house, the angle will change, and there's been babies who have suffocated through being in car seats. So I encourage them with that. We have a patient referral letter from Dr. Ashton in this pamphlet, and that's just basically saying, we've served you for your ultrasound, and now we're transferring you to your own doctor, and that's in every pregnancy packet. Okay, so back to the medical history and assessment. We will ask them if they've had a history of tubal ligation or ectopic pregnancy, and if they have, we will not do an ultrasound because of the possibility of them having, if they've had a tubal ligation or if they have an IUD in place, that's a high-risk situation, so we will, again, refer them to their doctor. We ask them if they've had pelvic inflammatory disease and the treatment date of that. Okay, the last part on this page, we have 3 screening questions. The first one is this pregnancy due to rape or sexual abuse? And we ask this question to these 3 questions to everybody who comes in, whether they're happily married. We're just trying to get a sense of where our clients are and if there's a problem at home. The second question we ask is, do you feel safe in your current relationship? And I actually had a mom share with me that she did not feel safe, and her boyfriend was waiting in the waiting room. And so I spoke with her at length about what needed to happen to make in that relationship. And this is the type of thing where if you come across this with a client, with a patient, you're going to want to get help from the staff member on duty that day. And that's not something you're going to be required to deal with on your own. And in this case, I was able to point her to the Life Matters program, and she and her boyfriend came in and worked that out. And I had to make sure that she and her child were safe going home that night, and I was able to do that. But again, you're going to want to check with the staff member on duty in making those kind of calls. The last question is, do you have to ask permission to use the bathroom? And that is specifically screening for sex trafficking. The last page deals with, the first question deals with complaints of pain, and there's just several questions related to that. The next question is on their blood type, and that's related to teaching about RhoGAM. And so we'll teach them that if they have a negative blood type, they'll probably get a shot of RhoGAM at 7 months during their pregnancy. And then if their baby has the opposite blood type at birth, they'll get another shot of RhoGAM. And that's just regarding Rh factor. The next question we ask is determine their risk of abortion mindedness, abortion vulnerability. Are they likely to carry? Are they undecided? So by asking that question, we can determine what their plans are for the pregnancy and then really counsel them through the rest of the ultrasound regarding the answer they give us. And then the last portion of the medical assessment is just a checklist of have you gone through basically everything that's in the chart. So it's a good reminder. And the final thing we'll have on this assessment form is our nursing comments or notes and your signature. So that is basically the medical assessment and the pregnancy packet. And following the ultrasound, we'll fill out the discharge summary. It has several choices related to if they have routine OB care, if we weren't able to detect a fetal heart rate. At that point, we will have them sign the miscarriage precautions, and we'll encourage them to contact their doctor if we find that there is no heartbeat. And we may have them come back in for another ultrasound if it was inconclusive. At that time, we'll have them sign that discharge summary. We'll also give them the patient exit questionnaire for them to fill out confidentially. And so what I will do is give them that exit questionnaire. I'll take the signed discharge summary. I'll give them the exit questionnaire and tell them to fill that out and then fold it in half and leave it on the desk there. And I'll go make a copy of the discharge summary and come back with that. And at that point, I'm able to ask them before they leave their appointment if they'd be willing to let me pray with them. I basically tell them we pray with all of our clients, but we know that everybody's on a spiritual journey and not everybody is at the same place. So we don't want to force that on anybody. But if they're interested, we'd love to be able to pray for them and their family. And at that point, generally, I would say, I've had very few people say no. I have had people say no, but that's an opportunity where I can even, if I just pray for them, I can pray the gospel at that time. Or that might open the door for another spiritual conversation based on something that they've said, or maybe at the beginning of the pink sheet where they said what religion they are, if they desire to be closer with God. All those things are giving me ideas as I get to this final point where I have an opportunity to speak into the appointment, speak into the patient about their spiritual life. Hopefully that was very helpful. And if you have any questions, feel free to contact me. Thank you.